Thank you for joining. We have Laura Brennan from the Oklahoma Poison Center joining us today. Just gonna go over some great information, helpful information that I think we probably just don't always have top of mind, don't really seem to think about it until we are in a moment where it's a crisis time and we need the info. So really great to have Laura joining us today and just hopefully get us a little bit more prepared. So if we happen to ever be in one of those moments, we can get help quickly, get our answers quickly, and get through that crisis or emergency situation, feeling confident with the information we'll learn from today. So thank you so much, Laura.
Well, thanks. I appreciate it. It's exciting to be here. It's a busy time of year for the Poison Center. Um, a lot of the things that we do are seasonal, of course. The increase in snakes in the spring and plants in the summer and certain other things, different times of the year we find ourselves facing different types of calls. And this is a time of year that we're usually really busy. This is a busy month always for us, and I'm really excited to be here. If you do have a question, please just ask, jump on in and ask. It's okay. Um, if I don't know the answer, our toxicologists are right next door in the room next door, and we can ask one of them. If we have a question that we just can't get an answer for. So feel free to jump in and ask questions, and we'll start. So for those of you that don't know, the Oklahoma Poison Center, kind of formerly known as Poison Control, is here on the campus. We're down in Nicholson, hidden away, but we are here on campus, and we're staffed by pharmacists and nurses. We're here 24 hours a day, 7 days a week. So many of you may have called the poison helpline before, the national number. Now, if your phone is, you just moved here from Texas or Kansas or California or somewhere, it's going to call the state from your area code. It's all the national number, but it's routed by area code. So you might say, "Oh, I just moved to Oklahoma City," and they could route you back to us, especially if that call has to do with a insect or snake or plant that may not be native to that area. For example, we had a call once where a lady was on vacation. She was from Oklahoma, but on vacation in Arizona, and called about a scorpion. And scorpions here are really not that big of a deal, but the ones in Arizona can be quite dangerous. So we work with poison centers across the country. We're all in connection with each other to help in those kind of situations. So we again save money on unneeded trips to the emergency room. About $11 million a year in unneeded trips to the emergency room. And for any of you on the presentation today that worked down in an emergency room, you can understand those resources. About this logo, you've seen this magnet and sticker 1,000 times. That's been the traditional look of poison control and the national association with the poison centers. And now we have this new look. As you can see down with the blue has been added, and they've removed the black and kind of changed that a little bit. So you may hear me say poison center, poison helpline. That's kind of the language we use now, and for all the poison centers across the country. But again, it's the same number. So I take this photo everywhere I go. If I do a mommy's group, if I'm presenting with nurses, first responders, law enforcement, it's just the best photo, in my opinion, to understand poison prevention. Unfortunately, this is a real photo from a situation where a grandpa, kind of one of those situations we see a lot in our state of grandparents raising grandkids. All of a sudden, this happens. I think we might be like 10th in the country for that. Anyway, that's antifreeze, and he put that in a Gatorade bottle and left that on a shelf in a low area, probably the garage, if I recall. So I call this picture epic failure, and I've taken it everywhere I go. Again, it doesn't matter how many initials someone might have behind their name. I want to share this powerful, powerful photo. And if you want to share this powerful photo, feel free to contact me and I can send it to you. But when we talk about poisonings, we are not just talking about, like this obviously wouldn't be an ingestion. The little boy drank this, thought it was Gatorade. It looks delicious, looks like Gatorade, but it's not, obviously. And it could be other ways that we don't necessarily always think of when it comes to poisonings. Absorption, injections, and other ways. We will talk about some of those. But if I'm going to start a video real quick, and talk about Halloween, as that's one of the things we were talking about. So Halloween and what scares us. Can everybody hear that video? Can you hear the noise? Okay, great. So anybody, again, I'm used to doing presentations where I'm really interactive and you guys are throwing out topics to me and I'm throwing them to you. So this is a little hard for me, but what scares us? Let's look at some of the things that we get common calls regarding on Halloween. So this is the big four: the cosmetics, the button batteries, choking hazards, and glow sticks. These are the some of the most common calls we get, and we'll look at those. Uh-oh, sorry, we messed up. My bad. Uh-oh, gotta go back. I apologize, it skipped. Uh-oh, now I don't know how to fix it. Here we go. Sorry. We'll start over. I'm so sorry. We'll just let it play. You know, that last part of that last slide, I wanted to. Did anybody remember? I don't know. You know, in the '80s, you watched those Halloween movies with those terrible jump scares, and I was thinking about putting a jump scare right at the end of that last one, like a Friday the. No, I'm just kidding. So let's. Here's. This is. The scariest one I feel, is the button batteries, and man, they can happen quickly. But dry ice, as it said, you want to not handle that if you can. You want to be careful when you handle it. Do not store it in a freezer or unventilated area. And cosmetics is really a big one. I know that the American Academy of Pediatrics has, they recommend using makeups instead of masks because of children falling. I know it's one of the number one days of the year for pedestrian and traffic issues. So they want kids to wear makeup instead of masks so they can have, clear visuals. But One of the things we want to remind people of is I know it's tempting, like, oh, here's the makeup we had from last year, or the makeup from 2 years ago, or 5 years ago, or however long, and you're digging out that old Halloween stuff, there could be a lot of bacteria in that. And so, as much as you'd be tempted to use it, we'd like people to not use old expired types. And as surprised as you might be, super glue is not the same as eyelash glue. And so we want to remind people about that as well. Novelty products, makeups do not have the same quality as traditional or theatrical makeup. So they could have dyes, fragrances, and oils, waxes that could actually lead to some type of irritation or reaction. They would say test in small area first. Well, actually, I would maybe a few days before Halloween, even to make sure that it's safe for you or your little one. Now, we talked about that button battery. Let me show you this photo here. This is an actual photo I took. I took a hot dog and I put two little button batteries in it. And I laid it on my desk. After about an hour, I cut it. And you can see from this powerful picture how quickly it burned. So that's why at Halloween, let's go back, these little candles, what else? Glowing, flickery things, little toys, all kinds of, you know, decorations, that have little tiny batteries and flashlights and noisemakers and a lot of really fun, cool stuff that you see at Halloween. Little trinkets from the carnival might have little tiny batteries in them. So it's a big one. It's a real serious situation when it comes to button batteries. When you look nationally at the substances most frequently involved in pediatric deaths, regarding, poison prevention and poison centers, you can see that batteries is right down here on the list. The most common, of course, are pain relievers, cough and cold medications, stimulants and drugs that they may have gotten into. But batteries are frightening and a quite dangerous situation. And you can see that the depth of that burn and how quickly, imagine that's in a toddler's soft tissue, inside. When we talk about poison prevention, whether it's Halloween or any day of the week, really, and any time of the year, you can prevent poisonings by, are you using that product safely? Safe use, safe storage, safe disposal. Our three key talking points, our three ways to share this with others. Safe use. Let's say it is a Halloween novelty toy with a little battery in it, or one of those funny greeting cards that sings and dances with Halloween and music. Those have little batteries. Are you using it correctly? If you're going to give it to a small child, is that correct? Is it tight? Is the battery secure? Are you taking it away when maybe they're done with it? Are you checking after they've played with it for a few hours? Is that back still on there tight with those little teeny tiny screws and a screwdriver that no one can ever find, right? I've been there. Safe storage. Are you storing it, whether it is a novelty toy with a little battery, or Halloween makeup, or cleaning products, or any alcohol, anything? Are you storing it up and away? Safe storage. And then lastly, again, not whether it's, no matter the product, are you safely disposing of it when it's done? And we talk about medications, of course, we talk about safe storage and disposal. So National Medication Take Back Day is actually this month. It's October 26th. And if you are in the Midwest City area, you can come and see us and our partners with the College of Pharmacy. We're going to be at the Walmart Neighborhood Market. You don't have to get out of your car. You just drive up and drop off all that old medication that you don't want and don't need. They changed your prescription 7 times when you took grandma to the doctor, and now she's got all this extra medicine. Bring her by, or I'm going to be over at with our partners at the Cleveland County Health Department parking lot, and that's actually going to be a Sharps site as well over there. to get rid of those. So all of their sites for the DEA, the Take Back Day, you can find them on their website through the Bureau of Narcotics, and a great day to clean out old meds. I know they can pile up. They really can, especially when you get to be old like me and they change your prescriptions all the time. So, when we talk about Oklahoma, and you can see down here, 1 to 5 years old, 41.9% of our calls. That's it right there. That's 40, that's a lot of our calls is that 1 to 5 year old. And did you know most of them are, not all, but a majority boys. About anybody has a boy, 1 to 5. If you're it, you tag, you win. But we want to keep them safe. We want to keep folks out of the hospitals, and you can see that most of those calls we get, like last year we had about 30,000 calls. And did you know, if you've called, and if we were in a regular class right now, I'd have you tell me about when you called and what happened and all those good things. But when you look at Oklahoma County, you can see we've had about 6,000 human exposure calls in 2023. And information, people don't realize that you can call with a question. So let's talk about questions. Maybe you're going to buy a new herbal supplement, but you don't know if it will interact with your meds. Call and ask. Do you know our pharmacists are here 24 hours a day? They can answer your question. You didn't know if you could combine your child's medicine with the blah, blah, blah over-the-counter medicine. Call and ask. You're buying this plant to put all around the patio when you've got toddlers and maybe, or pets. You don't know if they'll eat it, if is it toxic, how toxic is it. Call and ask. You can ask questions. And when people think of the poison control of old ye days, they don't think that when you ask questions, but you can call and ask a question. And we do that, and that's part of prevention. That's part of being preventative to poisonings. I am suggesting all the time when I meet with my senior groups and older adults, did you know that these certain medications, vitamins, herbals, and supplements will react with your blood pressure medicine, could react with this medicine and that. So call and ask. If your own pharmacist or doctor hasn't had the time to address that with you, we're happy to help it when we can. So that's important for folks to remember and to know. Now, here's something trending and new. Anyone, let's see. Take Back Day. Yeah, okay. I'm sorry, I looked at one of your questions. I'll get back to those in a minute. So, these are two new products. And you know what? You're a 5 year old, you can't read. Does it say spiked? Or that looks like Dunkin'. That looks delicious. And this new Sunny D alcohol seltzer, there's a tremendous amount of there's several new products coming out that are the name of known products. Everybody's on the seltzer kick. Everybody's on the spiked kick. And get ready for these phone calls. So, your child, or even maybe it's not a toddler, your 11-year-old goes to the friend's house and just grabs a Sunny D out of the fridge, isn't looking. These things can happen. It's important to talk to your kids about these. Talk about that, reading the container, understanding what it says, and again, for parents, safe storage. These are just two of them. I know there's a couple others that are coming out and as well. So when we looked at the national poison data from 2022, the most common exposures, and we talked about those button batteries, that would be down here at the bottom, the foreign bodies, miscellaneous, but household cleaning products, pain relievers, cosmetics, personal care products, and then dietary supplements, herbals, and things like this. And here's a great picture of our lookalikes. You guys have heard of lookalikes. I call them the blue drinks. And I've set these on a table at our event before. I had kids come up and go, "Oh, a blue drink," and try to grab one. And I'm like, not that one. And we talk about asking first, um, because they all look alike, especially windshield washer fluid. That one scares me a lot in these larger containers. And we just talked about those top ones right here, the cleaning products down to foreign bodies. But here's the rest if you are interested in what are the most common things, the common categories when we talk about pediatric exposures. You can see the most common things that we get calls regarding. Not surprising. Some of these flip every year. Some days, pain relievers and cleaning products, one is above the other one. But this is national and local. These top 10, these top five, we see that all over. And so these are the things that we focus on when we are out doing our presentations and our trainings. And I am excited to say that when we look at our pediatric calls for pain relievers that exclude opioids, but other pain relievers, our numbers, as you can see on this chart, have gone down a bit. And that looks from 2018 down to 2022. And that's good news that we're excited about. Also, when it comes to opioid exposures, those numbers have dropped considerably in the last few years. Now, when you look at poison prevention and poison center numbers, I will say that these are a piece of a puzzle. If someone has not called the poison helpline, or a first responder or emergency room, or a doc, or someone has not called us asking for our assistance, then we don't have those calls. You might have had 29 people go to the hospital last week with a kid who took opioids or got into someone's opioids, but if we weren't consulted or we weren't called, then that wouldn't reflect. But I still feel like in our numbers, which is a good representation, is that it's gone down quite considerably. When it looks at household cleaning substances, again, those are a big one. Those have gone down. Remember when everybody cleaned everything during the pandemic and that shot up? Tobacco and nicotine exposures have stayed steady, unfortunately. And then the big one, marijuana edibles. Ooh, if anybody knows how to fix this and wants to get involved, please let me know. We're working with a number of partners, in all seriousness, across the state. But you have your gummies, your vitamins, and these, I mean, dang, that does look delicious. I mean, I know that would taste good. And kids don't know. And what happens is an adult has their marijuana card, they leave their or cannabis, and they leave these edible products sitting out, and then a child gets in them and they eat the whole bag of gummies or whatnot. Here's our pediatric exposures that have gone up and up and up and up and up. So, and many of you might have seen this before. So, when you talk about medical marijuana with children and poisonings, you're talking about severe nausea, vomiting. Often they are hospitalized. It happens too often. We also, if you didn't know, the Poison Center helps to spread information regarding recalls and alerts. We work with the CDC and the FDA. This one was just a couple of weeks ago. We had several people that were hospitalized, and this was regarding this product that was called diamond shrooms. It actually wasn't mushrooms. There was a lot of other chemicals. They look like these little ice cream cones that are supposed to be a marijuana product, but it had a lot of other things in it. And so when these things come up, we try to share that on our Facebook and our social media and our website to let people know about recalls of these type of products. And again, they look delicious. They look like a food or a candy product. When you call the Poison Center, they're going to want to ask your name, your age, your weight. The reason the weight, if you leave your child with a babysitter, one thing we always forget is to tell them how much your child weighs, because that would depend. If you leave them with Aunt so and so and she's babysitting, or the 15-year-old girl down the street, your child ingests something and they call the poison helpline, we have to know how much they weigh because we'll have to calculate their weight based on the amount of the product that was ingested to know if we can help them at home and monitor them and watch them and keep them at home, or we need to send them on quickly to the emergency room, to a hospital, or have IMSA come. And so we do have a fact sheet, and it's on our website that we lists. It's called a babysitter checklist, and one of the things on that is the child's weight. So that's important. A lot of other fact sheets, handouts, resources you can find on our website as well. Let me get up here. I think we're getting, are we almost time? Are we time, Lindsay? We're good?
You're doing pretty good.
Okay, great. So we have a newsletter that we're going to be putting out in the future that is for medical professionals to stay connected with our poison center staff, our toxicology experts, the latest in information on toxicology research and trending topics. So that will check our website. That will be coming soon. We'll be working on that as well. And here is my information to get in touch with me if you have a community group, a professional organization that you'd like myself or one of our pharmacists or toxicologists to come and do a training with. We're happy to come and visit and share. So let's go to these questions. Thank you, Krista. I love the music. Feels like everything now has batteries. Yes, everything. For Take Back Day, do they take vet meds? Yes. It's anything, there's no liquids and no inhalers. So otherwise, yes. If you have old vitamins, anything that's in pill form, again, the location in Moore will also take sharps. But the one in Midwest City that we're hosting, any pills, you can bring any pills that you need. Let's see, another question. I have to go to another commitment. Okay, thank you for presenting. Help me to think about common mistakes. Okay, well, thank you guys. Any other questions? Or I know kind of went through a lot of that quickly. It's usually several hours that we kind of break down a lot of these topics and get into depth on some of them. But it's an overview. Are there take back days for Tulsa? Yes, there are 15 locations in Tulsa on that day, and they're on the Tulsa Health Department's website. I believe there are 15. Yes, if you miss Take Back Day, we have a permanent location right over here at the OU Police Department, and I have a list of about 20 other locations all over Oklahoma City of the permanent drop boxes. And I can upload or share that with Lindsay, or I'll add it to our Facebook page and you can find that. That's a great question.
Yeah, absolutely. I'll make sure in the follow-up email to include those resources as well.
Excellent. Yeah, Take Back Day in Tulsa. It's again, they have 15 locations. I know there are others all over the state that day. And Oklahoma County, there used to be several, and some things happened, and now we're trying to bring some of them back. So we're excited. And if you have friends and family in-laws, outlaws, I don't know who they are, out in Midwest City, send them our way that day. We'd love to have them come and clean out that medicine cabinet. So. And I'll put those on our Facebook. I appreciate everyone's time today. Again, if you have a question, if something happens during Halloween, your child gets that glow stick and they bite into it and it splashes on their face and it gets in their eye, you know what's going to happen. Everybody's tired, driving on the way home. Give us a call. We're here to help. Again, we can walk you through how to handle these things and what to do. So. Thank you so much. Thanks.
Thank you, Laura. Yeah, some great information to keep in mind, and then also to keep the 1-800 number handy And I
Yeah,
also,
save it in your phone.
yeah, absolutely. And enjoyed the little check sheet for the babysitter check sheet. Things, again, kind of don't really tend to think of, like what information should we leave the babysitter or caregiver looking after our kiddo. So I'll make sure include that as well. So thank you so much. Again, if you guys don't be shy, if something comes up, whether it's like she said, plants or um, animals, bug bites, insects.
Yeah, email me. I'm right here on campus, or if you want to, if you're down at HTO and in our building down, anybody coming down to Nicholson for tea, let me know. If you have questions, we can visit, or if you need resources for your clinic, what area that your clinic, your office, your patients, your consumers. If you want to give them the poison helpline magnets, if you want to give them the Halloween fact sheet, if you want things, send me a message and I will get it to you on campus, or we'll meet and make sure they get it. Okay? I really appreciate you sharing that with others on campus.
Absolutely. Well, thank you again, Laura. Everyone, thanks for
Thank
joining and
you.
have a wonderful rest of your day.
Thanks, guys.